behavior, but what do we think about, to what extent does one's culture have on one's relationship and experience with pain?
So this is actually something I've been thinking about a lot. My research assistant, Melanie Fu, is Chinese in background, and we've talked a lot about the difference in the way people describe pain, like types of words that they may use. And there's a literature, I haven't read this on Dark article, but there is a literature that describes how in different cultures, people are more likely to describe like back pain in different terms, right? Maybe they're more like physical terms in the US is much more common, like, oh, there's pain in my back. Whereas in other cultures, it might take on more of a, not really like a supernatural, but more of like a psychologic connotation, or use different terms to describe it. So there's actually a whole literature within the pain field trying to develop questionnaires that can then evaluate patients from different cultures, trying to target similar like physiologic concerns, but using different language that may be more identifiable by those people.
Alan, any thoughts on there before I keep moving forward? Some stuff that I want to follow up with.
Well, yeah, I mean, whenever you're dealing with language, I think there's so many differences across cultures and sort of how people describe things and the norms with which they describe things. And, you know, how the language for psychological pain gets really mixed up with the language for physical pain in weird ways. Right. But I think pain expressions, nonverbal expressions, facial expressions in the voice are actually, in our research, some of the expressions that are found to be the most universal across cultures.
Interesting.
And so when you move away from language, interestingly, there seem to be more commonalities in how pain is expressed.